The NIMHANS parent training videos were developed as a PhD thesis in the National Institute of Mental Health and Neurosciences. The team involved PhD scholar Megha Rupa, that's me, from the Department of Clinical Psychology, Dr. Umahiri Save, professor at the Department of Clinical Psychology, and Dr. Jayashree Ramakrishna, professor and head at the Department of Mental Health Education at NIMHANS. 29 mothers and 5 fathers were involved in the study. The average age of the mothers was 32 years and the average age of the fathers was 37 years. All parents were largely in good psychological and physical health, and the relationships between members of the family was cordial. All families had comfortable living standards with respect to their income and housing conditions. All parents were at least graduates. All fathers were managers, doctors and engineers, and majority of the mothers were homemakers. Parents provided information about 33 children who were aged between 3 and 8 years. 18 of them were boys and 15 of them were girls. There were no major illnesses in the children just before, during or after their birth. All the children reached their milestones age appropriately. All children had a predominantly sattvic temperament, which means to say that the children were mostly calm, they were sociable, they had moderate levels of activity, their appetite and sleep was alright, and they were largely easy to manage. And most of these children were securely attached to their mothers. The difficult behaviors that were reported by parents centered around basic needs, which concerned eating, sleeping, and there were also problems that related to non-compliance, manners, sibling fights, there were academic difficulties, watching too much of TV, there were temper tantrums, and so on. But despite these difficult behaviors, it was also found that these children were high on pro-social scores, which means that they were high on good manners or good behaviors such as sharing, caring, and being kind to others. Parents were involved at every stage of the study with the intention of making the videos as real life as possible. The parents and children who have acted in the videos are real parents and children who provided their consent and assent to act. Most of these parents and children were okay with retaining their original names in the videos. The scenarios that are depicted in the videos do not necessarily resemble the real life of the parent and child actors. Randomly chosen videos were presented to 6 experts. The experts consisted of a child psychiatrist, a clinical psychologist, and a psychiatric social worker with over 10 years of experience, as well as experienced parents who currently have older children but have had the experience of parenting children this age. A brief video-based parenting intervention was carried out with 17 parents who have children aged between 3 and 8 years. The parents who were involved in the intervention expressed that the video-based intervention was very helpful for them in terms of understanding their children's behaviors better. They also felt more confident in handling some of the difficult behaviors of their children. Overall, their sense of competence had increased, and this increase was statistically significant at the end of the intervention.